morning. You may be seated. Welcome to the School of Public Health 2019 Convocation. Today we're here to recognize and celebrate the accomplishments of 70 graduates, all of whom have completed a rigorous and challenging course of study. In doing so, they have successfully navigated many exams, presentations, research papers, and the dreaded group project. Nothing teaches life skills like the group project. Graduates, your academic program has trained you and prepared you to make an impact, to make a difference that improves the public's health, especially those populations facing inequities and health disparities. As you begin your careers, you will be faced with choices regarding which problems to tackle, which communities to help, and how hard to push for change. In public health, we believe that a person's health and well-being should not be determined by their race or ethnicity, gender, sexual identity, or how much money they have. It should not be the case that where you live dictates the cleanliness of your water or air, whether you have access to safe and healthful foods, whether you and your family can access health care, safe and affordable housing, or effective transportation systems and high-quality education. These basic needs should be available to everyone. In your work, graduates, remember that you are the champions for those who have been placed on the margins of society, those who lack economic and political power, those who have been told implicitly and explicitly that they don't matter or that their life is not as valuable as others. In public health, we fight against injustice. A wise and courageous man once said, "We're not simply to bandage the wounds of victims beneath the wheels of injustice, we are to drive a spoke into the wheel itself." You will have to fight for those who are vulnerable again and again and again in your careers. It's a fight worth fighting, and you're ready. We, the faculty, have engaged you, trained you, watched you, and even learned from you. It is that you've been certified, approved, and stamped ready. Go forward with purpose, with confidence, with commitment to the work of social justice. It is the work of public health. You're ready to make a difference. Go forth and do so. At this time, I'd like to invite Dr. Shannon Self-Brown, who is the chair of our Department of Health Policy and Behavioral Sciences, to introduce our student speaker.
Good morning, everyone. Welcome to Georgia State on this very special day. I am happy this morning to introduce Alexandria Dansby, our student speaker. Alexandria is graduating from the MPH program with a concentration in health promotion and behavior. As her final culminating experience, Alexandria evaluated the Healthy Community Initiative, a program designed to advance the skills and resources of mayors and elected officials to advance health equity by eliminating health disparities. During her matriculation in this program, she attained a master's degree in biology from Georgia State University, the College of Arts and Sciences. She also worked as a graduate teaching assistant in the biology department microbiology lab, as well as a teaching assistant for the GSU 1010 student orientation instructor for the School of Public Health. Alexandria served on the 2020 Tech Committee and was selected as one of the 10 students to travel to Kampala, Uganda. There she studied the effects of alcohol harm on the population, especially the youth under the age of 16. Upon returning from Kampala, she presented her obtained research at Georgia State University International Topics Conference, as well as the poster at International Education Week. Alexandria has accepted a position at Triage Consulting Group to work as an associate healthcare consultant. She aspires to pursue a physician assistant degree and merge her skills gained from her MPH to aid in lowering maternal mortality rates in minority populations in the metropolitan Atlanta. Please join me in welcoming our speaker, Alexandria Dansby.
Thank you so much, Dr. Self Brown, for that introduction. Greetings to the Georgia State University School of Public Health faculty, staff, distinguished guests, family and friends, and those watching via live stream who cannot physically be present with us today. Thank you for being here to support my classmates and I as we celebrate this milestone. To my fellow classmates, the spring class of 2019, we made it. We're here now. But interestingly enough, I wasn't supposed to be here. No, not because of a serious medical issue or almost being dismissed from the program, but because getting a Master of Public Health degree was not in my plan. However, along this journey, I have truly understood that everything happens for a reason. So for most of us here, the abbreviation MPH can mean multiple things: Master of Public Health, miles per hour, or even Mr. Potato Head for my Toy Story fans. However, to my classmates, our MPH means to us moving past hindrance. With many of us being working students, this journey has been short of easy. Life hit a lot of us, and hit us hard. I mean, dead smack in the middle of our foreheads. You would have thought we should have had a V8. Thankfully, we had great support systems. So we would like to take this time to thank you, our support systems. From spouses to parents, children, other family members, friends, and especially our wonderful faculty and staff, we thank you. Thank you for pushing us and seeing something in us that we did not always see in ourselves through this tireless journey, but it was worth it. So those rejections that you all got, that we all got, we thought they were derailing our dreams, but they were just our redirections. So do not always receive that no as your only and final answer. From speaking with some of my classmates, some people knew from the beginning that they wanted to go into public health, but for quite a few of us, it wasn't in our plan. It just presented itself. So if you had not heard that no from that medical school, veterinarian school, dental school, that job, that school counselor, or whomever, you likely would not be where you are today. But it also took you saying yes and being obedient to your purpose. You could have easily continued down your desired path and kept running into hurdles, or what we thought were hurdles, but were really detours. And now that we've made it this far, there's more no's to come, likely lots of them. I know many of us applied to jobs so we can secure the bag upon graduation, but we keep getting turned down due to lack of experience, or simply because we didn't have the plug. But continue applying for those jobs. What is for you will be for you. Now, imposter syndrome is real. If someone would have told me that I would be speaking up here today, I would have laughed, and I mean loud, because public speaking is not my niche. I am no Maya Angelou, not a Viola Davis, and especially no Michelle Obama. But I'm not supposed to be. I'm supposed to be me, and the same goes for each of you. Do not strive to reach the same success as someone else, but find what success looks like for you. Continually evolve into the greatest version of yourself. So once you get that new job, you will be the new kid on the block. You will make mistakes, and you will have your ideas shut down. You may feel that you do not deserve to be in that position or have a seat at the table, but you're there for a reason. We were all trained differently. We were not supposed to fit into a mold. Do not apologize when it comes to your ideas. whether they are about programs or evaluations you would like to implement or projects you would like to work with. Be bold, but remain humble. In the words of Mrs. Michelle Obama, find your flame and keep it lit. Be persistent. GSU has pushed us to work in groups for this reason, to ensure that all parties are heard. Speak up and do not be afraid to ask for help. When I told someone I was getting an MPH, the person stated that the public health field was oversaturated and that anyone could get an MPH. This could or could not be true, but I know only those who are truly passionate will do the work. Everyone cannot make it through biostats, epi, and especially not through defending a thesis or capstone project. The public health profession is constantly evolving. We are all needed, and our journeys are just beginning. We all have to be prepared to step out of our comfort zone at any given moment. We are unable to grow unless we are made to feel uncomfortable. I will leave you with one of my favorite quotes that has gotten me through this journey. The race is not given to the swift, but those that endure to the end. Spring class of 2019, we arrived. Let's keep moving past hindrance. Thank you.
Alexandria, thank you so much for those wonderful words. And I think I did see a little bit of Michelle Obama there, so very well done. So next, I have the privilege of introducing Michelle D'Amico. She is the winner of our 3-minute thesis contest for Georgia State University. Now, the 3-minute thesis competition tasks students with taking over a 100-page document into a 3-minute presentation, which is very, very difficult to do for anyone, especially those of us with a Southern drawl. But we are very excited that the School of Public Health has had winners for the past several years, and Michelle has continued this tradition, and we are very, very proud of you. So please welcome Michelle to tell us about her thesis, which is entitled Examining Associations Between Availability of Paid Sick Leave and Preventative Health Behaviors in a National Sample of Older Adults.
All right. Americans are living longer than they were a few decades ago. Many of us will also be working longer, either because we want to or because we have to. According to the Bureau of Labor Statistics, workers aged 55 and up are the fastest growing segment of the workforce. Older Americans, meanwhile, tend to have multiple chronic health conditions and make up a disproportionately large chunk of our nation's healthcare spending. So what can we do to prioritize prevention and optimize health in this group? One policy opportunity is paid sick leave, which provides workers with paid time off to take care of their health or their family's health and healthcare needs. Previous research has linked paid sick leave access to more recommended health screenings, to fewer visits to the ER, and even reduced risk of death. But those findings were among younger workers. This research, sorry, I don't know which slide to gesture to. This research uses data from the 2014 Health and Retirement Study, a nationally representative survey of Americans aged 51 and up. The aims of this work are to determine the associations between access to paid sick leave and preventive health behaviors, like getting a cholesterol test, going to see the dentist, or getting a flu shot. And so the results? After controlling for factors like union status, time on the job, education, ethnicity, people who did have paid sick leave had higher odds of seeing the dentist and higher odds of getting a cholesterol test compared to those who didn't have paid sick leave. That's 1.6 times the odds for the dental visit and 1.2 times the odds for the cholesterol test. So these findings are important because they provide preliminary evidence that paid sick leave access might also be important for protecting the health of older workers through these preventive health behaviors. So if you think about a cholesterol test being important for detecting risk of stroke, or taking care of your oral health and going to see the dentist so you can avoid life-threatening infections. Employers, policymakers, healthcare professionals, and honestly, anyone who pays taxes should have a vested interest in this work because of the implications for enhanced workplace productivity, better population health, and hopefully reduced healthcare spending. Thank you.
Thanks for that fabulous presentation, Michelle. At this time, we're going to transition to our student and faculty awards. Every year, we believe it's important to recognize the great work of our outstanding graduates, those who have gone just a little above and beyond their peers in either their commitment to our school or to our communities. This year, we welcome 3 new awardees to our ranks of recognition. The first award we would like to bestow our Public Health Student Achievement is our Public Health Student Achievement Award. This award is given annually to a MPH and a PhD student in recognition of their outstanding academic performance, scholarly contributions to the field, and service to the community. Our first awardee is Rachel Culbreth. Rachel is graduating with her PhD with a concentration in epidemiology. Her dissertation title is The Impact of Child Maltreatment on Suicidality, Polysubstance Abuse, Substance Use, and Sexual Risk Behavior. Rachel has published 10 manuscripts and has made numerous oral presentations, 7 of which she was the lead author. She recently presented at the NIH Global Mental Health Conference and is presenting at the Society for Prevention Research at the end of this month. Her research focuses on violence, HIV, and substance use, both in the US and globally. She plans to pursue a career in academia. Rachel, would you please come to the stage? Our second awardee is someone who you already know, Michelle D'Amico. She is graduating with her MPH with a concentration in environmental sciences. Her thesis is, which you just heard, associations between paid sick leave availability and health outcomes in the 2014 Health and Retirement Study. She's worked as a graduate research assistant with Dr. Betty Lai, who recently left us, and in the Urban Studies Institute in the Andrew Young School of Policy Studies. She's managed in that role and conducted geospatial analysis of large data sets related to housing and transit. She's also been a teaching assistant for Epidemiology Methods 3, a rigorous course here in our program with Dr. Matt McGee. Michelle has recently accepted an offer to work with Booz Allen Hamilton as a health statistician. Michelle, would you come join me over here to accept your award? Our next student award is called the Diane Caves Memorial Award. This award is named after Diane Caves, a Georgia State Master of Public Health student who was tragically killed in the 2010 Haitian earthquake while on assignment for the Centers for Disease Control and Prevention to work on the President's emergency plan for AIDS relief. This award is given annually to the student who best exemplifies the selflessness and dedication to public health that Diane exhibited. This year's awardee is Joanna Caldwell. The title of her thesis is Outness, Discrimination, and Serious Mental Illness Among LGBTQ Southerners. She worked with Dr. Eric Wright and Dr. Richard Rothenberg. She served as a graduate research assistant with the Georgia Health Policy Center, working on a project that looks at how housing is related to health called Home for Healthy Futures. Joanna has also worked at the Georgia Department of Public Health as a bilingual research interviewer in the WIC program. She will continue to work part-time on the Homes for Health Futures project after graduation and hopes to pursue full-time research project coordination work with a project that aligns with her core values of serving marginalized communities and centering health equity. Joanna, would you please join me on the stage? The next award is one that recognizes more than just one individual making an impact on our students, but instead recognizes a public health organization for its demonstrated commitment to our graduate students in public health and its continued support of practicum opportunities. This year's recipient is Voices for Georgia's Children. Joining us today to receive the award is Melissa Haberlin. Melissa, would you please come forward? And before I go to the next award, I should point out that Melissa is an MPH graduate of our program. So graduates, as you go forward, please reach back and help our students as they seek to find placement opportunities for their practicums. The next award that I want to give is the Practicum Award. While today is really a day to celebrate the great achievements of our students, we also want to recognize that as a school, we do not stand alone in our quest to develop and put forward the next generation of public health researchers and practitioners. It takes a broad community of support, and today I want to recognize our Practicum Preceptor of the Year. The School of Public Health would like to recognize Dr. Mary Helen O'Connor from the Office of International Initiatives here at Georgia State. Dr. O'Connor, would you please join me on stage to receive your award? All right, at this time, we're going to give some awards to our faculty. So for faculty awards, I want to invite Jidong Huang to the stage. He's the chair of our Faculty Awards Committee and an associate professor in the Department of Health Policy and Behavioral Science. Please welcome him.
Good morning. It gives me great pleasure to give awards to 3 of my great colleagues here in School of Public Health. So the first award is Exceptional Service Award. The Exceptional Service Award is to recognize excellence in service by a full-time SPH faculty member, including service to the School of Public Health, Georgia State University, and discipline-specific service. This year's recipient of this award is Dr. Emily Grabeel. Dr. Grabeel has been a clinical assistant professor in School of Public Health since 2012. She provides leadership to many community projects for the Center for Leadership in Disability, including her roles in leadership with 3 state agencies focused on improving the lives of thousands of children in Georgia with disabilities. For example, she serves on the state leadership team for Project Launch. She is also part of the interagency director team with the Georgia Department of Behavioral Health and Developmental Disabilities. She is also a project-aware state management team member for the Georgia Department of Education. In addition, Dr. Gabriel is active in professional organizations, review for professional journals, sits on committees, and provides leadership with Georgia Association of Positive Behavioral Project. So please, let's welcome Dr. Emily Gabriel to the stage. Thank you. The second award is Excellence in Instruction Award. The Excellence in Instruction Award recognizes a full-time faculty member in school public health for outstanding achievement in instruction who displays commitment and achievement in student learning. And this year's recipient of this award is Dr. Elizabeth Armstrong Mensah. Dr. Armstrong Mensah has been the instructor for record for 16 courses in just 5 terms since joining the faculty full-time. With a teaching load of 7 courses per academic year, she has consistently earned an overall score of 4.85 out of 5 on her student evaluations. Her teaching evaluations describe her as an instructor that actively engages her students in learning, provides students with prompt feedback, communicates course content effectively, and organizes course activities to allow for productive use of class time. Dr. Armstrong Mensah has coordinated the semi-annual Meta series for students, which brings together students, faculty, and leadership for an evening of networking. In addition, she has started a student publication club which aims to engage students who wanted opportunity to develop and submit research to conferences or for publications. So congratulations, Dr. Elizabeth Armstrong Mensah. Please join us. Last but not the least is Outstanding Faculty Award. The Outstanding Faculty Award is given in recognition of superior accomplishments in teaching, research, and service to a full-time SPH faculty member. And this year's recipient of this award is Dr. Claire Spears. Dr. Spears has demonstrated remarkable success in research and scholarship since she joined GSU in 2016. She has published 59 peer-reviewed articles, including many on high-profile journals. Dr. Spears is the principal investigator of an NIH-funded grant that examines the mobile phone-based smoking cessation interventions for low-income smokers. She is also a key co-investigator on several NIH-funded grants. Dr. Spears' grant funding so far exceeded over $5.2 million. Dr. Spears is an excellent instructor and has consistently received positive student ratings for her courses. She has served as a mentor for many SPH students, including undergraduate, MPH, and PhD students. She is a strong contributor to Thesis and dissertation committees in School of Public Health. Dr. Spears has also served on many faculty committees in our school, and she founded the GSU Mobile Health Technology Research Collaborative, an initiative to foster cross-university collaborations in mobile phone-based health research. What amazing achievements. So congratulations, Dr. Claire Spears. Please join us here.
Another congratulations to all our award winners. Well done. It's my pleasure now to introduce our alumni speaker, Brittany Carter. Brittany is a two-time GSU graduate. She received her BA from Georgia State University in 2012 and her MPH in 2017. She concentrated in health promotion and behavior, and her master's thesis focused on an understanding of the smoking behaviors among people living with HIV in higher risk and lower risk areas of Atlanta. While completing her thesis, Brittany completed and won first place and People's Choice in the master's round of the inaugural university-wide 3-minute thesis competition. Currently, Brittany is an ORISE Fellow at the Centers for Disease Control and Prevention. In this capacity, she conducts research and evaluation to support the health communication and social marketing campaigns and projects in the Division of HIV, AIDS, and Prevention. Brittany is currently a member of CDC's Young Professional Network, and she serves as the interim secretary for CDC's Employee Association for Georgia State University alumni Panthers at Work. Prior to joining the CDC, Brittany served as a research coordinator for the School of Public Health. While here, she coordinated a randomized controlled trial of mindfulness-based smoking cessation treatment for racially, ethnically diverse, low-income adult smokers. Brittany has nearly 5 years of professional and educational experience working with marginalized populations to alleviate health disparities and promote behavioral change. Please join me in welcoming Brittany Carter.
Thank you again, Dr. Self-Brown. After looking at the program, I realized I'm like the only thing standing between y'all and getting y'all degrees conferred, so I'm definitely not going to take too long. So good morning, everyone, and what an even greater morning for our graduates. If you haven't already, pinch yourself, because yes, the moment that you waited years for has finally arrived. All the late night cramming and early morning revisions was well worth it. When you hear the cliche, time flies, it's not as relevant until you put yourself in other shoes. For instance, it doesn't feel as though 2 years ago, I was sitting exactly where you are thinking, oh my gosh, I'm really done. Now I need new business cards so I can flex. We all have our own stories, our own experiences, and our own paths. But now what we each share is our passion for public health. Whether you promote health as a statistician, an epidemiologist, by evaluating policies, being environmentally conservative, or addressing health inequities in your work, you're leaving your mark in this vast space as a public health professional. You are now fully equipped with the skills needed to excel in any opportunity that you seek. Now, many of you already have your next steps set in place. If your next steps are obtaining another master's or doctorate, great, and best wishes. If your next steps are CDC, great. And shameless plug, if any of you Panthers are interested in continuing to build a strong network of individuals who #bleed blue at CDC, please let me know so you can be added to the Panthers at Work listserv, okay? Okay. If you'll be joining the workforce, Peace Corps, MBOs, or CBOs, great. If you're not too sure what your next steps are, don't fret. As an early career professional with an MPH from GSU, realize that you have now graduated from a program that has over 600 alumni, a university that has over 80 research centers, a university that is the leading economic center in the Southeast, and a university that is ranked as one of the most ethically diverse universities in the United States. I can go on and on about GSU's accolades, but I say all of this to say, us Panthers stick together. We're here for you and can serve as mentors for all your future endeavors. As a recent graduate, you have left your mark at GSU. Now it's time to leave your mark in your communities and ultimately the world. After graduation, I had the unique and amazing opportunity to audition and be selected for the refresh of CDC's Let's Stop HIV Together social marketing campaign. This campaign focuses on reducing HIV stigma. At the time, I didn't realize how much of an impact my contribution would have. As a young African-American woman featured in this campaign, it gave me the chance to serve as a symbol of promise and a leader in my community against the HIV epidemic. Being able to take part in this campaign and living in the heart of downtown Atlanta, where we are disproportionately affected by HIV, was a life-changing experience. Talk about urban reach and global focus. So I say to you, leave your mark. Even if your marks are tiny, leave them. Whether you are staying here, please get connected with the School of Public Health Alumni Group and the broader Georgia State University Alumni Group. Keep in contact with our distinguished professors and our always helpful faculty because they can provide you with not only guidance but additional insights. Take advantage of LinkedIn because it can truly be your best friend. In each and everything that you do, remember, you earned your degree. Even if it took hours in the SAS lab, 200 plus hours in your practicum, multiple and extensive thesis, dissertation, ILE, capstone drafts, you earned it, and no one can take that away from you. Thank your parents, friends, and anyone else who supported you on this journey, because as we know, it was not done in solitude. As a true public health professional, I'm going to close with some final takeaway points because that's how every public health presentation ends, right? First, follow your passion, because ultimately, when you do what you love, it doesn't feel like a job. Second, network as much as possible. You'd be surprised to know how many opportunities come your way because someone knows someone who knows you. Third, and certainly not least, stay true to your values and morals. It's gotten you this far and won't fail you now. So, until next time, congratulations, Panthers.
Thanks so much, Brittany, for that wonderful word. Next is really the moment that I think everybody's here for, and that's the degree conferral. Here at Georgia State, Master of Public Health and our master's degrees are conferred by the dean of the respective colleges. So at this time, I'm going to ask the MPH graduates to please stand. By the virtue of the authority delegated to me by the President of Georgia State University and the authority vested in the President by the Board of Regents of the University System of Georgia, I hereby confer upon you and each of you the degree described in the official records of these commencement proceedings with all the rights, privileges, and responsibilities thereunto appertaining. You may now move your tassels to the left. Congratulations. If you would be seated, I would also like to recognize our Doctor of Philosophy graduates. I believe we have at least one with us. They were recognized at the hooding ceremony last week, but I know Rachel is here. If there are others, please rise. At this time, I'd like to invite Ms. Denise Gavea to the podium to lead the presentation of degree recipients.
Good morning. This is the time where we will individually recognize our graduates for spring 2019 and summer 2019. Please follow the direction of Gina and proceed on to the stage. If I can have pomp and circumstance, please. Ramo Adebodio. Cleopatra Adiriji. Lauren A. Hart. Kara Alexander. Laura Anderson. Chimaka Agnelli. Dimple Bott. Brandy Retain. Tara Butler. Rebecca Butler. Joanna Caldwell. Aneem Chaudhry. Michelle D'Amico. Alexandria Dansby. Corbett Jedabon. Alan Eastman. Hala Elahi. Jordan Ellis. Olayemi Farino. Kiana Harper. Lauren Hay. Brittany Hayes. Catherine Henderson. Kezia Ilyich. Charnicia Jackson. Morgan Johnson. Sarah Khan. Nikita Kute. Helena Katima. Yi Sil Lee. Kathleen Laporte. Joseph Madden. Femi Maliaka. Matu Mukri. Giselle Moses. Aaron Muirhead. Maylot Mulageta. Kiera Nelson. Shivanji Panchal. Danielle Perry. Taylor Phillips. Aaron Pulliam Cannon. Alexis Roberts. Brenda Ruiz. Padmini Sangaraju. Sunanda Sarkar. Herschel Smith IV. Morgan Smith. Deborah Soyemi. Kayla Staley. Forrest Strickland. Catherine Suarez. Manson Chow. Janae Tyler. Anya Nehi Ugbebi. Anna Vukmanovic. Alexia Williams. Terriana Woodward. And Dr. Rachel Kilbreth. Please join me in congratulating all of our graduates one more time. Thank you.
Please be seated. Graduates, congratulations on your achievement. This is truly a day of celebration and recognition, but we must also realize that we couldn't have gotten here alone. Clearly, the GSU faculty and staff, if you all would stand and be recognized, have helped along the way. But there are other people that are real enablers, and those are the people that are sitting behind you. Those that instill in you ambition, tenacity, perseverance, and a desire to learn. Those that were always behind you regardless of what else was going on. So graduates, please join me in thanking all those here today who are sharing your accomplishments. And without them, you wouldn't be the person you are today. So will the parents and the grandparents of the graduates stand and be acknowledged? Will the spouses and partners please rise and be acknowledged? And finally, would the children and friends and anyone else who has contributed to the success of these graduates please stand and be acknowledged? And all, let's give our graduates one more round of applause. Graduates, again, congratulations. Please stay in touch. Keep us informed of your progress. Return to visit us often. Send money. We wish you the very best in your future endeavors. Thank you.